All right, get ready to dive in. We are tackling a mountain of research today, all about children's oral health.
Sorry, we're going to be uncovering some secrets about taking care of those tiny teeth. Everything from infancy through the toddler years.
Oh, the toddler. But you know me, I am all about practical tips.
Absolutely.
And I have to say, while prepping for this, I learned a lot of things that blew my mind.
Oh, yeah. Like what?
Like, did you know that you're supposed to start your baby's oral hygiene routine before they even have teeth?
You're absolutely right. We're talking day one, folks, right when your baby arrives. You can start gently wiping their gums with a damp washcloth.
After feeding.
After each feeding, yeah, and before bedtime.
Huh. It sounds like such a simple thing, but I guess it really does set the stage for good habits later on. Huh.
Absolutely. And it keeps those gums clean and free of bacteria.
Now, you're not using toothpaste at this point, right?
No, not yet. Babies can't spit yet, and you don't want them ingesting fluoride toothpaste. A clean, damp clot is all you need.
You know, I wish I'd known about that, Smear. Don't fear tip for when they are old enough for toothpaste.
All about those little mnemonics, right? Speaking of things parents need to remember, let's talk about saliva.
Oh, okay.
You don't want to share saliva with your baby,
Like what?
like cleaning a pacifier in your mouth before giving it to your baby.
Oh, okay.
We're trying to avoid transferring those cavity-causing bacteria as much as possible.
Makes sense. I never really thought about that. It's amazing how those tiny teeth can be so vulnerable, even before they erupt.
Yeah.
So speaking of erupting, when do those first teeth usually pop up?
Well, typically the timeline starts around 6 to 8 months of age.
Okay.
But remember, every baby is different. They all develop at their own pace.
Okay, that's good to know. But I gotta say, teething, it's a tough time
Oh, yeah,
for everyone involved.
for sure.
So any tried and true methods for soothing those sore gums?
Well, a gentle gum massage can work wonders.
With just your finger.
You can use your finger. Yeah, a clean finger, a wet gauze pad, or even a chilled teething ring.
Oh, I remember those.
Yeah. And if your little one is really struggling, your doctor might recommend over-the-counter pain relievers specifically designed for teething babies.
Oh, okay. So those teething rings that you pop in the fridge are a lifesaver.
For sure.
But what about when those teeth finally do arrive and you're still breastfeeding? Is that a problem?
That's a great question and one that we get a lot. Now, while the World Health Organization recommends breastfeeding for up to 2 years, there's no right answer when it comes to this. It really comes down to personal choice and what works best for your family.
So, finding that balance, right?
Yes, finding that balance.
But what about the risk of tooth decay?
Yeah,
Because, breast milk is natural, but it does still contain sugars, right?
you're absolutely right. While breastfeeding does have a lower risk of what we call baby bottle tooth decay compared to falling asleep with a bottle of juice, for example, those sneaky sugars are still present.
So it's not a free pass.
Not a free pass, no. Those regular gum cleaning routines are still very important, even for breastfed babies.
It makes you realize how vigilant you need to be from the start.
Yes, and it's a good habit to move the bottle or breast away once your baby is finished feeding. Minimize the time those sugars are on those little teeth and gums.
Okay, that makes sense. So we're wiping those gums, keeping an eye out for those first teeth, being mindful of those sugars. Anything else parents need to know about caring for those new teeth?
Well, one thing that often surprises parents is that even babies can get cavities.
Wait, seriously, how is that even possible? I always thought cavities were more of a big kid problem.
Right. Well, the reality is those tiny teeth are vulnerable from the moment they emerge.
Huh.
Remember those sneaky sugar attacks we talked about?
Uh-huh.
Even small amounts of sugar can create a breeding ground for bacteria in mouth, and those bacteria produce acid that can attack tooth enamel.
So even those sips of juice or that bedtime bottle can really do damage.
Exactly. That's why early dental visits are crucial. The American Academy of Pediatric Dentistry actually recommends scheduling your baby's first dental appointment by their first birthday.
Their first birthday?
Yeah, even if they haven't sprouted a single tooth yet.
So you're saying mark that first birthday with a trip to the dentist.
Yes, exactly. It's like a well-baby checkup, but for their teeth.
I love that.
The dentist can assess their development, check for any early signs of decay, show you proper cleaning techniques, and answer any questions you have.
So it's all about prevention, right?
Yes, prevention and setting them up for a lifetime of healthy smiles.
Now that makes me think about something else parents often worry about. Thumb sucking and pacifiers.
Oh, yeah?
Are those comforting habits really that bad for a child's teeth?
Well, prolonged sucking habits can potentially lead to some issues down the road.
Like what kind of issues?
We're talking things like misaligned teeth, jaw development problems, and overcrowding.
Hmm.
So you want to encourage them to stop those habits by the time they are 3 years old.
Years of supervised brushing, huh?
Ideally, yes.
Is there any wiggle room here, or are we setting ourselves up for a rebellion?
Well, it's important to remember that thumb sucking is totally normal for infants and very young children.
Right.
It's a natural soothing mechanism. The key is to try and wean them off of it by age 3, because that's when those permanent teeth start to come in.
Right.
And you don't want them coming in crooked because of a sucking habit.
Oh, that makes sense, because those baby teeth are just paving the way for those adult teeth, right?
Exactly. We want to make sure they have a good foundation to work with.
But what happens if one of those baby teeth takes a tumble?
Oh, yeah,
Because, toddlers are tiny daredevils.
that's true.
Should we be rushing to the dentist for every chipped tooth?
Well, here's the thing. Even if it's just a baby tooth, a chipped, broken, or knocked out tooth still requires emergency dental care.
Wow. I think a lot of people would assume since it's a baby tooth, they're temporary, it's not a big deal.
That's a common misconception. It might seem less concerning than losing a permanent tooth, but those baby teeth act as placeholders for those permanent teeth. They guide them in, make sure they come in properly aligned. If a baby tooth is lost too early, it can cause crowding and problems when the permanent tooth tries to erupt.
See, even those little teeth play a huge role.
A huge role.
All this talk about baby teeth makes me think to the bigger picture.
Yeah.
Like how these early years influence bite alignment, what dentists call malocclusion.
Right, exactly. Malocclusion, or a bad bite, can be caused by a number of factors, and we've already talked about prolonged pacifier use and thumb sucking after the age of 3. Those can come back to bite you, so to speak.
No pun intended. But what are some other things that can lead to a bad bite?
Well, things like cleft palate or lip, facial trauma, airway obstructions that lead to mouth breathing, and tongue tie can all increase the risk.
Hold on, are we talking about tongue tie, where the tissue under the tongue restricts movement?
Exactly.
I've heard of that, but I never realized it could affect bite.
Oh, yeah. Tongue tie can affect how a child swallows and positions their tongue, which can impact their bite over time.
Wow, it's amazing how all these things can have a ripple effect.
Yeah.
So if sucking habits and other factors can cause malocclusion, what can parents do to prevent it?
Well, early intervention is key. That's why those early dental visits are so important. The dentist can identify any potential risk factors and recommend strategies.
So it's all about being proactive.
Exactly. And remember, those baby teeth are more than just placeholders.
I had no idea until we started this.
Yeah, they are essential for chewing and speaking properly, and they help hold space for those permanent teeth. Taking care of those baby teeth is about more than just preventing cavities. It's about ensuring proper development for those adult teeth down the road.
It's about setting them up for a lifetime of healthy smiles right from the beginning.
Exactly, and that brings us back to those first dental visits. Remember, the American Academy of Pediatric Dentistry recommends scheduling that first appointment by your child's first birthday.
Even if those teeth haven't made an appearance yet?
Even if they haven't made an appearance.
It's never too early to start building a relationship with the dentist. Get those little ones comfortable with the whole experience.
Absolutely. And during that first visit, the dentist can demonstrate proper brushing techniques, give you personalized advice on caring for your child's teeth, and address any concerns you might have.
It's like having a coach in your corner,
Exactly.
guiding you every step of the way.
That's right. Building that trust, that rapport from an early age can really make such a difference.
So we've talked about the importance of those early visits, all the things that a dentist can do during those appointments. But let's be real. Getting a toddler to cooperate with brushing,
Oh, yeah.
that can feel like a Herculean task sometimes.
Definitely. It's a whole other level of negotiation.
Any tips? Any strategies? What works?
Well, first and foremost, for toddlers, you got to make it fun.
Okay.
Turn brushing into a game.
Oh,
Sing silly songs, use a timer, let them pick out their own toothbrush. Anything to make it feel less like a chore and more like a fun activity.
that's a really good point. They're much more likely to cooperate if they're enjoying it.
Absolutely. And don't underestimate the power of modeling. Let them see you brushing and flossing. Talk about how much you enjoy taking care of your own teeth.
Ah, the old monkey see, a monkey do approach, right?
Exactly.
I swear my kids are always watching me, even when I don't think they are.
Oh, they absorb everything.
Yeah.
And when it comes to those dental visits, preparation is key.
Okay.
Talk to your child about what to expect. Read books about going to the dentist. You can even role play the experience using a stuffed animal.
I love that. Yeah, just taking the fear out of the whole thing.
Exactly. And never underestimate the power of praise, positive reinforcement. Celebrate their cooperation, acknowledge their efforts, make them feel proud of taking care of their teeth.
So we're making it fun. We're setting a good example. We're preparing them for what to expect. And then we're showering them with praise when they do a good job.
Yeah,
Sounds like a winning combination.
that's the goal.
Now, you mentioned flossing.
Yeah.
When do we introduce that into the mix? Flossing for babies, it just seems so advanced.
It might sound surprising, but those spaces between baby teeth, they can trap food and bacteria just like adult teeth. As soon as those teeth start touching, it's time to start flossing.
Okay, you've convinced me. Flossing it is. Now, you mentioned that even babies can get cavities. What's the deal with baby bottle tooth decay? I've heard that term, but I don't really know what it means.
So baby bottle tooth decay, it happens when sugary liquids like milk, formula, or juice are allowed to linger in your baby's mouth for prolonged periods. The sugars in these liquids feed the bacteria in the mouth, and those bacteria produce acid, which then attacks the teeth.
So it's not just about the sugary drinks, it's about how long they're in contact with those teeth.
You got it. That's why you want to avoid letting your baby fall asleep with a bottle of milk or juice.
Oh, okay.
And if you do give them a bottle at bedtime, make sure it's just water.
Makes perfect sense. So we're wiping those gums, we're brushing those baby teeth, we're flossing. Is there anything else that parents should be doing to protect their child's oral health?
Well, one of the most important things is paying attention to diet.
Right, of course.
We all know sugary foods and drinks are the biggest culprits when it comes to tooth decay.
Right.
But are there any tooth-friendly snacks we can be giving our little ones?
That's a great question. I'm always on the lookout for healthy snack ideas.
Well, crunchy fruits and vegetables like apples, carrots, and celery are a fantastic choice. They help scrub those teeth naturally
Okay.
and stimulate saliva production, which helps neutralize those cavity-causing acids.
So it's like nature's toothbrush.
It is. It is.
I love it. What about dairy products? I mean, I know calcium is important for strong bones. Does it play a role in dental health too?
Absolutely. Dairy products like cheese, yogurt, and milk are all rich in calcium and phosphate, which are essential minerals for strong teeth.
That's good to know. What about dessert?
Oh, dessert.
I mean, those sweet treats are inevitable. Is there anything that's a little less likely to wreak havoc on those tiny teeth?
Well, with all sweet treats, moderation is key. But if you're looking for something less harmful, dark chocolate is surprisingly a good option.
Wait a minute. Are you telling me there's hope for my chocolate cravings?
There is.
Okay, so tell me more about this dark chocolate magic.
It actually contains compounds that help fight tooth decay.
Huh.
Of course, we're talking about dark chocolate, not the sugary milk chocolate varieties.
Okay, right, of course.
And even then, it's best enjoyed in moderation.
Moderation is key.
Exactly.
Got it.
Now, while we're on the topic of things that can harm those little teeth, let's talk about dental emergencies.
Okay.
We talked about knocked out teeth, but what are some other red flags that parents should be aware of? What should they be watching out for?
Yeah, what should we be looking for?
Well, any signs of pain, swelling, or discoloration in the mouth should be checked out. If your child is complaining of a toothache, refusing to eat, or has a fever accompanied by dental discomfort, it's time to call the dentist.
So basically, any unusual behavior related to their teeth or mouth, call the dentist.
Yes, exactly. Early intervention is key. And speaking of early intervention, let's circle back to those first dental visits. I know we've touched on this, but I think it's worth reiterating how important those early appointments are.
Yeah, I agree. I think a lot of parents might be wondering when exactly they should schedule that first visit.
Well, the American Academy of Pediatric Dentistry recommends that first visit by your child's first birthday, even if they haven't gotten any teeth yet.
It's less about the teeth themselves and more about establishing that relationship with the dentist, right, and creating positive associations with dental care right from the beginning.
Exactly. You want to make those early visits as positive as possible. Bring a familiar toy or book, sing songs, make it a fun experience for your child.
I love that. Yeah, just creating those positive associations early on can make all the difference.
Absolutely. And don't forget to praise them for cooperating. Positive reinforcement goes a long way.
This has been a great conversation, and I think our listeners have learned a lot. I know I have. It's just amazing to me how much there is to know about caring for those little teeth.
It really is a fascinating subject. We've covered a lot of ground today, from those pre-brushing rituals to navigating dental emergencies and fostering a love for those pearly whites.
It's been a lot, but before we move on, I have to ask you, what stood out to you the most? What surprised you or changed your perspective?
I think what surprised me the most is just how vulnerable baby teeth are. I used to think, oh, they're just temporary. They're not as important as permanent teeth. But now I realize how important it is to take care of those baby teeth for their oral health now and in the future.
I'm with you on that. I'm definitely going to be a lot more diligent with my own kids' dental care after this deep dive. I mean, there were so many good tips.
I'm glad to hear that. Knowledge is power, and I hope this conversation has empowered you to be proactive about your children's oral health.
It has. I think one of the biggest takeaways is the importance of finding a dentist you trust, building that strong relationship with them.
Absolutely. Your dentist can be your guide, your resource, your partner in ensuring your child's oral health is on the right track.
It's like having that trusted advisor in your funeral. Someone helping you navigate all the twists and turns of raising a tiny human with healthy teeth.
You got that right. But it's not just about finding a good dentist.
What do you mean?
It's about finding the right approach for your child.
Okay,
Every child is different.
sure.
What works for one child might not work for another.
Yeah, right.
Some kids respond well to sticker charts and
Oh,
rewards,
yeah,
while others might need a more gentle, playful approach.
yeah. So I guess it's all about being flexible, right?
Yes, exactly.
And tailoring your approach to your child's individual needs.
Exactly. And be patient. Remember, building good dental habits takes time and consistency.
Now, we've been focusing mainly on babies and toddlers. What about older kids? Do the rules change once they hit, elementary school and beyond?
The fundamentals of brushing twice a day, flossing daily, and seeing the dentist regularly, those never change. But as kids get older, you can start giving them more responsibility for their own oral care.
So it's like a gradual shift, right?
Exactly.
From supervised brushing to independent brushing.
Exactly. And as they become more independent, it's important to have open and honest conversations with them about the importance of oral health.
Right, so it's about explaining, the why behind the what.
Precisely. Help them understand how taking care of their teeth can prevent cavities, bad breath, and other dental issues. And don't forget the cosmetic benefits. A healthy smile can boost their confidence and self-esteem.
Oh, yeah.
The healthy smile can make a world of difference.
That's so true.
It's about helping them understand that oral health is an important part of their overall well-being.
This has been such a good deep dive. We've gotten so much information. But I have to ask you, what is the biggest takeaway you want parents to remember about children's oral health?
If I had to boil it down to one key message, it would be early intervention and prevention are key. Establishing good dental habits from day one can make all the difference in ensuring your child has a lifetime of healthy smiles.
So it's not just about those baby teeth. It's about setting the stage, really.
Exactly. Think of it as an investment in their future well-being.
That's a good way to put it. Well, before we wrap up, what is the one thing that you wish every parent knew about caring for their kids' teeth?
There's just so much information out there.
Yeah.
It can be overwhelming for parents to sift through it all.
Right.
They hear conflicting advice. It can be confusing to know what to do.
I totally get it.
Do I brush with water? Do I use a smear of toothpaste? When do I floss?
It can be so overwhelming.
It really can. So if I could give parents just one piece of advice, find a dentist you trust and build a strong relationship with them.
Yeah.
They can be your guide, your resource, and your partner in ensuring your child's oral health is on the right track.
That is such great advice. Because having that trusted dental professional in your corner can really make all the difference. It's like having a coach, who's there to support you every step of the way.
Precisely. They can answer your questions, address your concerns, and provide personalized guidance based on your child's individual needs.
So finding a good dentist is like finding a good pediatrician, right?
Exactly.
It's about finding someone you feel comfortable with.
Yeah.
Someone who listens to you.
Yeah.
Who you trust to provide the best possible care.
You got it.
Now, speaking of things we've talked about, let's talk about brushing those baby teeth.
Ah, yes, the art of toddler toothbrushing, a skill that requires patience, persistence, and maybe a few silly songs to keep them entertained.
It can be an adventure.
It really can.
So when do we officially introduce the toothbrush? I know we start with those gum massages.
Yeah.
But when do we upgrade to the real deal?
As soon as that first little tooth erupts, it's time to grab a baby toothbrush. Soft bristles designed specifically for those tiny mouths.
And just water at first, right?
Just water at first.
No toothpaste till they're a little older.
Exactly. Remember, babies can't spit yet, so you want to avoid any fluoride ingestion.
Right.
Just gentle brushing with water is perfect.
Okay, that makes sense. But eventually we do want to introduce that fluoride toothpaste.
Yes.
When is the right time for that?
Around 12-18 months, you can start using a tiny smear of fluoride toothpaste, about the size of a grain of rice.
Oh, wow.
Remember, smear, don't fear.
That's right. Smear, don't fear. I love that.
Exactly.
But even then, we're still supervising very closely, right?
Absolutely, until they develop the dexterity to brush effectively on their own, which usually happens around age 6 or 7.
Got it. So we're talking years of supervised brushing. It's a commitment,
It is.
but a worthwhile one for sure.
Definitely. And don't forget about flossing.
Oh, right.
As soon as those little teeth start touching, it's time to add flossing to the routine.
Wait, flossing for babies? That seems advanced.
It might seem that way, but those spaces between those baby teeth, just like with adult teeth, they trap food and bacteria. You want to get those little flossers in there early, set them up for good habits.
Okay, you convinced me. Flossing it is. I have to admit, flossing those tiny teeth, that just sounds like a challenge.
It definitely takes practice and patience.
Oh, for sure.
But there are ways to make it a little easier.
Okay, like what?
You can use those pre-threaded flossers, the ones designed for kids.
Yeah.
Those make it much easier to maneuver.
Oh, okay.
And just remember to be gentle but firm. You want to get in there, clean those spaces between the teeth,
Okay.
but you don't want to hurt them.
Right. Those pre-threaded flossers are game changers, I gotta say. I wish I'd had those when my kids were little.
Yeah.
Okay, so we've covered a ton of information about baby and toddler teeth, but what about when those permanent teeth start coming in? Do the rules change as kids get older?
The fundamentals of good oral hygiene stay the same.
Okay,
Brushing twice a day
right.
for 2 minutes each time,
Uh-huh.
flossing daily, and seeing the dentist regularly.
Got it.
But as kids grow, you can start giving them more responsibility for their own oral care.
Right, so it's a gradual shift
Exactly.
from us doing it for them to them doing it themselves.
Right. And as they become more independent, it's important to talk with them.
Yeah,
Have open and honest conversations about why oral health is important.
it's about explaining the why, right? Not just telling them to brush and floss, but helping them understand why.
Precisely. Explain how taking care of their teeth now can prevent cavities, bad breath, even more serious dental issues later on. And, don't forget the cosmetic benefits. A healthy smile can boost their confidence and self-esteem.
Oh, absolutely, yeah.
A healthy smile can make a world of
That's
difference.
so true.
It's about helping them understand that oral health is part of their overall well-being.
This deep dive has been amazing. I mean, we've gone from wiping those gummy grins to talking about toddler toothbrushing. Now we're talking about setting them up for a lifetime of healthy smiles. What a journey. Any final words of wisdom for our listeners?
At the end of the day, it's all about consistency.
Yeah,
Just like, you wouldn't skip bath time or dead time.
yeah.
Make brushing and flossing a non-negotiable part of your family's routine. And remember, you're not alone on this journey. Your dentist is there for you. They're your ally, your resource, your partner in keeping those smiles sparkling.
Well said. It's about making it a habit, right?
Exactly.
Just like any other healthy habit. And having a trusted dental professional in your corner, I mean, that can make all the difference. I think that's the perfect note to end on. This has been an incredible deep dive into the world of children's oral health. I know our listeners are walking away with so much great information and practical advice. Thanks for being here.
It's been my pleasure. Until next time, may your flossing be flawless and your smiles be bright.